Hypertension, a global health concern, affects over 1.4 billion people worldwide and is a leading cause of mortality. In China, the prevalence is particularly high, with over 25% of adults and a staggering 50% of those over 60 affected. Risk factors include high salt intake, obesity, sedentary lifestyles, smoking, and aging. Hypertension significantly increases the risk of cardiovascular diseases and complications. Globally, it accounts for approximately 10 million deaths annually, with China seeing over 40% of cardiovascular and cerebrovascular fatalities directly linked to hypertension. The challenge lies in improving medication adherence, which remains suboptimal globally. Research suggests that health literacy plays a crucial role in understanding medication instructions and improving adherence. Illness perception, a patient's subjective understanding of their disease, is influenced by personal knowledge and experiences. A stronger perception of illness severity can lead to better self-management and adherence to prescribed medications. The actor-partner interdependence model, APIM, offers a unique perspective, emphasizing the interdependent nature of relationships, particularly among close pairs like spouses. It allows for the examination of an individual's influence on their own outcomes, actor effect, and their partner's outcomes, partner effect. This model is particularly relevant in hypertension management, where medication adherence, emotion regulation, and illness perception are interconnected. The power of dyadic relationships in hypertension management. In the context of hypertension, the dynamics between patients and their caregivers, often spouses, can significantly impact health outcomes. For instance, a patient's depressive mood may burden their spouse, while supportive behaviors from the spouse can influence the patient's blood pressure control and treatment adherence. APIM provides a framework to analyze these dyadic interactions, exploring shared management mechanisms within couples or patient-caregiver dyads. This study aims to explore the interactive relationships among illness perception, health literacy, and medication adherence in patient-spouse dyads. By employing an extended APIM framework, the research seeks to clarify the mediating pathways and provide a scientific basis for dyadic interventions to improve treatment adherence in hypertensive populations. Study design and methodology. From August 2024 to March 2025, hypertensive patients and their spouses were recruited via convenience sampling from a designated district. The inclusion criteria for patients included a clinical diagnosis of hypertension, being currently married with a living spouse, aged between 18 and 85 years, and capable of basic comprehension and communication. Exclusion criteria included a history of psychiatric disorders and severe comorbidities. Inclusion criteria for spouses included being aged 18 to 85 years, serving as the primary caregiver for the hypertensive patient, and being mentally alert and able to complete the questionnaire independently. Exclusion criteria for spouses were the presence of serious physical or mental illness. Based on the APIM, with an expected actor and partner effect size of 0.25, alpha equals 0.05, and 1 beta equals 0.9, the minimum required sample size was 171 dyads. Considering the need for at least 200 cases for structural equation modeling and accounting for a 10% attrition rate, the target sample size was set at 223 dyads. Ultimately, 274 hypertensive patient-caregiver pairs were surveyed, resulting in 256 valid and complete questionnaire sets, with a response rate of 93.43%. The study was approved by the Ethics Committee of the Second Affiliated Hospital of Chongqing Medical University, No. 2024-070025. Survey tools and data collection. The research team designed a general information questionnaire to collect demographic and clinical data from patients and spouses. This included age, gender, education level, living arrangements, income, duration of hypertension, medication type, and number of comorbidities for patients, and age, gender, education, and economic status for spouses. The Brief Illness Perception Questionnaire, BIPQ, was used to assess illness perception in both patients and spouses. The Health Literacy Management Scale, HELMS, evaluated the health literacy of chronic disease patients and was adapted to assess spouses' health literacy. The Chinese Medication Adherence Scale, CMAS, evaluated medication adherence and the caregiver contribution to self-care of chronic illness inventory, CCSCCII, assessed caregivers' contributions to patients' self-care. Trained research personnel administered all questionnaires. Participants were briefed on the study objectives and procedures and signed informed consent forms. Patients and their spouses completed the questionnaires independently in separate rooms. Completed forms were immediately collected and checked for completeness. Trained investigators provided one-on-one verbal guidance to participants who had difficulties understanding or completing the questionnaires, accurately recording their responses. Statistical analysis. Data analysis was conducted using SPSS 27.0. Continuous variables conforming to a normal distribution were expressed as mean plus or minus standard deviation, while categorical data were presented as frequencies and percentages. Harman's single-factor test assessed common method bias. Pearson correlation analysis evaluated variable relationships. The API-MEM model was constructed using AMOS 29.0 with maximum likelihood estimation for model fitting. The bootstrap method tested the significance of mediation effects, with a two-tailed p-value less than 0.05 considered statistically significant. Results and discussion. The study collected a total of 256 valid questionnaires, and the basic information at admission is presented in Table 1. The results of the common method bias test indicated no significant evidence of bias, with the first factor explaining less than 40% of the variance for both patients and spouses. Descriptive statistics and correlation analyses of illness perception, health literacy, and medication adherence are presented in Table 2. All correlations were statistically significant, p less than 0.05, suggesting meaningful associations among the variables for both patients and spouses. The illness perception and health literacy of patients and their spouses positively affected the medication adherence of patients. The actor-effect analysis revealed that the patient's health literacy partially mediated the relationship between their illness perception and medication adherence, effect value 0.028, p less than 0.05. In contrast, the spouse's health literacy exhibited a stronger partial mediating effect between their own illness perception and the patient's medication adherence, effect value 0.240, p less than 0.05. Regarding partner effects, the patient's health literacy partially mediated the influence of the spouse's illness perception on the patient's medication adherence, effect value equals 0.042, p less than 0.05. The spouse's health literacy completely mediated the effect of the patient's illness perception on the spouse's own medication adherence, effect value equals 0.139, p less than 0.05. These findings highlight the pivotal role of the spouse's health literacy as the central pathway connecting the patient's disease awareness to the spouse's adherence behavior. The positive correlations observed among illness perception, health literacy, and medication adherence between patients and their spouses, p less than 0.05, may reflect shared cognitive environments and behavioral reinforcement within the household. Spouses often influence each other's disease understanding and communication efficacy, and their support directly impacts medication adherence. Implications for clinical practice. The study findings emphasize the importance of designing clinical interventions that target both patients and their spouses. Tailored educational programs and training can enhance disease understanding and support capabilities. Family-based management strategies, such as joint diet planning, and the use of medical communication tools can improve comprehension. Integrating community resources and dynamic assessments of illness perception can further improve medication adherence. Incorporating spouses into chronic disease management programs through family-based education, skills training, and collaborative goal setting can significantly enhance treatment outcomes and long-term adherence. The study's results underscore the need for a robust familial support structure in chronic disease care, with a focus on strengthening the